Let us now go to visual diagnosis of the limbs. The topic is leg edema. Edema is generally caused by Yang deficiency of the lung, spleen, or kidneys, or by retention of dampness. In some cases, edema may also be due to an accumulation of dampness in the legs that prevents the proper transformation of fluids. In this case, besides showing edema, the legs will look generally puffy. Edema caused by a deficiency of yang or an accumulation of dampness shows pitting. That is, the skin indents and changes color when pressure is applied. In a few cases, edema may be due to stagnation of qi and blood in the legs, in which case it is non-pitting. If the edema is pitting, that is due to spleen yang deficiency, kidney yang deficiency, or dampness. If it is non-pitting, it's qi or blood stagnation. Let us look at a case history of a 50-year-old man who had been suffering from edema of the legs and abdomen. He has breathlessness, night sweating, and an inability to lie down for 8 months. A Western diagnosis revealed that he suffered from congestive cardiac failure. He also experienced a feeling of heat in the head and a feeling of throbbing of the head. From a Western diagnostic point of view, this was due to hypertension. Interrogation revealed that he also experienced a feeling of pressure in the right eye in the morning, tinnitus, thirst, and a tendency to diarrhea. He was slightly overweight and his body shape was the fire type. That is, he had a relatively round body shape, round head, and small hands and feet. However, the fire type should walk briskly and talk fast, whereas this patient walked and talked rather slowly. His complexion was dull and pale. His tongue was very slightly pale and very slightly red on the sides, with a deep hard crack and a sticky white tongue coating. His pulse was weak on both rear positions, but especially on the right, weak on the right front position and slippery on the left front position. The diagnosis is the contradiction between the patient's fire body shape and his slow walk and talk indicates straight away a potential problem in the fire element in the heart. This is confirmed by the presence of the deep hard crack on the tongue. This usually indicates either severe emotional problems or a heart problem. The heart problem is also confirmed by the slippery quality on the heart position, which is all the more striking considering the weak quality of most of the other pulses. When only the heart pulse is slippery, especially in its lateral or medial aspects, it often indicates the possibility of heart disease in a Western sense. Thus, in this patient, the contradiction between the body type and his walking and talking, the pulse and the tongue, all clearly indicate the possibility of an actual heart disease, which was of course confirmed by the Western diagnosis. In terms of patterns, there is a deficiency of spleen and kidney yang, manifested by the tinnitus, tendency to diarrhea, and weak pulse on both rear positions with water overflowing to the heart, which is manifested by the edema, breathlessness, and inability to lie down. In addition to these two patterns, there's also liver yang rising, stemming from the kidney deficiency, manifesting with a feeling of heat and throbbing of the head, thirst, pressure in the eye, and red sides of the tongue. As treatment for the edema of legs, we use REN 12, REN 9, REN 5, spleen 9, spleen 6, kidney 7, bladder 22, bladder 23, and bladder 20. Thank you so much for your attention.